Mental health is for everyone, and mental health challenges affect everyone. By taking what we know from the science, what's been shown to have evidence to be effective, and applying it in the everyday lives of our young people, I think that's what makes AIM for Youth Mental Health such an important organization.
So many young people who appear for treatment have mixtures of problems. They're not just depressed, they're not just anxious, and so we need treatments that span an array of different problems. What AIM does is multifaceted. I think one of the most important things they do is building a network of support for young people who are beginning research careers. You give people a start, and then there's a lifetime of great work that has potential to help many, many young people.
AIM is really stepping in by funding early career scientists who we need to grow more of to be able to do this work, to understand what is causing youth mental health problems, how do we better treat youth mental health problems, but also not only funding those young investigators, but funding research that puts clinicians, patients, and researchers together in the same room.
Scientific Advisory Board is a roster of my heroes. There are people whose work I have admired for so long and whose science is solid.
By connecting our youth researchers with our funded researchers and the doctors on our Scientific Advisory Board, we're ensuring that the research we support reflects the lived experiences of young people and really takes in the challenges and recommendations that they're giving us in real time. It's really about bridging the gap between science and youth voices to create more informed and effective solutions.
With the AIM Ideas Lab, this is community-engaged research that is by youth, for youth, about youth. And that's why I think their work has had such impact in a short period of time.
The AIMS Ideas Lab is a wonderful way to provide data from students surveying each other. And that information then is sent to the mental health community. So those teens get to survey, they get to research, they get to present, and they get to be part of the solution in the conversation. Then those results are actually shared with the school and the county and the mental health community.
It's so fascinating and so interesting. You get to learn so much about the people around you, things that you wouldn't expect. You also might get a confirmation of things that you may have already expected, but it's just so validating and so empowering. I definitely encourage every high school teen to go through this kind of program.
Biggest challenge that we had when AIM first started was everyone talked about mental health as a stigma, that it was hard to talk about. And that universe has changed over the past 10 years. Now our biggest challenge is it's such a big problem. How do we tackle it? And I think what's most remarkable about AIM is that we've created programs that look for answers from kids. We're not just going the parents down or academia down. We're really asking kids what they need on the front lines, and their voices are remarkable and they're very clear. What struck me the most about AIM is that it's focused on hope. It's not focused on how big the problem is or the pain that people are suffering. It's founded in the roots of, we have a hope for a better way of being, and we're all dedicated toward finding that and helping as many kids as possible.